by criminals every year. For that reason, President Trump, Vice President Vance, and Acting Attorney General Blanche have rightly activated the DOJ and our fraud-fighting partners to combat this fraud epidemic head-on, because no one should be able to rip off the United States of America and get away with it. I am honored to be joined today by some of our best fraud fighters: CMS Administrator Dr. Mehmet Oz, U.S. Attorney David Metcalf, Pennsylvania Attorney General David Sunday, HHS Inspector General March Bell, Executive Director of the White House Task Force to Eliminate Fraud Scott Brady, and our local FBI, HHS OIG, DEA, and IRS criminal investigation leadership. This team of public servants is committed to looking further, digging deeper, working night and day to unmask the fraudsters stealing the wealth of America and bring them to justice. And this commitment is reaping dividends right here and right now in Pennsylvania. Today, we are announcing criminal charges against 19 defendants for fraudulent home health care schemes that targeted Pennsylvania's Medicaid fraud program and resulted in over $4 million of fraud. 18 of these defendants were charged in the last 12 days as part of a strategically coordinated law enforcement operation between the Fraud Division, the U.S. Attorney's Office, and the Pennsylvania Attorney General's Office. The cases today build on the work that we recently announced in Minnesota, where we charged 15 defendants for systematically looting 7 state-managed Medicaid programs out of more than $90 million, treating those programs like a piggy bank until one of them had to be shut down entirely because there was nothing left. The shelves were empty. The Commonwealth of Pennsylvania is one of the highest spenders for home care services in the nation, with spending on home care services exceeding $8 billion in 2025 alone. These home care programs are designed to allow America's most vulnerable to live with dignity at their own home instead of being forced to leave their families for a nursing home. The program is innovative. It allows friends and family members to receive funds from Medicaid to provide necessary physical care for a loved one. Used properly by honest citizens, the program allows those with physical ailments to be cared for by those they trust the most. But infiltrated by greedy and deceitful opportunists, this program becomes a money tree, a gravy train for criminal fraudsters. The cases today make that abundantly clear. They are not paperwork errors or good faith accounting errors. They involve supposed home health aides who billed the taxpayer for home care services but never actually provided those services, and supposed Medicaid patients who conspired with other fraudsters to bill the taxpayer for completely unnecessary health services. In one case, we charged 2 home health aides and 2 purported patients with causing over $400,000 in false claims to Medicaid for services the aides supposedly performed when, get this, they were actually hospitalized, working at other jobs, and even in jail. Yes, the allegations include a scheme that billed taxpayers for home care services provided when the person supposedly doing that work was sitting behind bars. That, of course, is not health care. It's just pure theft. Another indictment charges a father and son for engaging in a fraudulent Medicaid scheme. In short, according to the allegations, the father didn't need the care and the son wasn't giving it. The son claimed to be providing services to his father while he was actually working as a driver for a ride-share and food delivery service. And in fact, on one occasion, the defendants allegedly billed Medicaid for services that supposedly occurred at the exact time the son was in the midst of a traffic stop in which he was cited for possession of marijuana. On another occasion, on the very day that the son billed Medicaid for a full day of in-home care for his father, the father was not home at all. He was in a courtroom watching a different relative get sentenced for defrauding this same program. These fraud schemes not only rob Americans of their hard-earned money, they also steal the trust in our communities, destroy the public's confidence in our public benefit systems, and perhaps worst of all, sow seeds of doubt that honesty and hard work is the right path after all. That is why justice matters, to punish the wrongdoer, restore hope to victims, and to deter others from choosing the wrong path. And justice is on the move. Earlier this year, we announced a new West Coast healthcare strike force to combat fraud in California, Nevada, and Arizona. We have also announced a Medicaid strike force approved by Acting Attorney General Blanche to mobilize 15 additional fraud prosecutors nationwide to combat Medicaid fraud. Just last week, we convened a historic federal-state partnership event in Columbia, South Carolina, where leaders from across 7 states in the Southeast gathered to strengthen coordination and expand joint anti-fraud initiatives. And we have launched a historic $300 million grant program to allow state and local prosecutors to join the DOJ and fight fraud and other crime. I thank Attorney General Sunday for being one of the very first offices to join our grant program, and we look forward to receiving multiple special prosecutors from the Attorney General's office in the near future. As another step in our growth plan, we are announcing today that our Northeast Healthcare Strike Force team is expanding here to Philadelphia. This will place dedicated fraud prosecutors right here to further root out the fraud in Pennsylvania. This district has a long-standing tradition of not only prosecuting egregious frauds like the ones charged today, but also a history of excellent corporate enforcement, both civilly and criminally. In fact, today the U.S. Attorney's Office is announcing charges against not only individuals, but a company, a home health agency that participated in the fraud. We are proud to join in partnership with U.S. Attorney Metcalf to ramp up our collective efforts to root out fraud here in Philadelphia and across Pennsylvania. This remains the early stages of the build-out of our fraud-fighting team. With the support of President Trump, Vice President Vance, and the White House Task Force to Eliminate Fraud, Acting Attorney General Blanche, and the entire fraud-fighting apparatus, the Department of Justice will continue expanding our reach across the country to pursue all fraud, no matter how large, no matter how small, no matter how hard. And I will conclude with this. To those taking advantage of home health funds that are so critical to allowing aging and ill Americans to live and receive care at home, your time is up. We will no longer tolerate fraud against our most vulnerable citizens and our most important health programs. And to anyone engaged in healthcare fraud of any kind, of any size, we see you, and we are doing everything we can to bring you to justice. The era of getting rich off the backs of our programs for our sick, elderly, and disabled is over. Thank you all for being here. I'll now turn the podium over to Dr. Oz. Thank you.
I want to thank the President, the Vice President, Secretary Kennedy, and many others involved in the anti-fraud task force that the White House is beautifully organizing for an all-of-government approach. And I say that because with using all the lever arms that the federal government has, allows us to help and protect people who are dependent on Medicare and Medicaid, as you'll see during these presentations. Colin, the all-star team you put together, there's many members on the dais, but the U.S. Attorney's Office, the Eastern District of Pennsylvania, the Northeast Strike Force, the DEA, FBI, HHS OIG, the Criminal Investigation Units, the Pennsylvania Attorney General's Office, all these groups have come together. We need states involved, and I'm speaking to that issue as the person who has to look at all the numbers as the administrator of CMS. Now, we're facing a personal care services crisis around the country. The surge in enrollment of individuals in these programs is stunning. So shocking, we have to double check our numbers. We don't think it's possible that it's happening, but it is. In California and New York, the number1 job in the entire state is personal care services. Guess what? It's good to be home, because it's true in Pennsylvania too. 50% dramatically more people serving in the personal care services space, that's home care, than is in retail. That's where Pennsylvanians are going. It's becoming a jobs program. Medicaid fraud in this state is costing taxpayers for care that was never delivered, or even worse, harmful. It's costing patients their health, their trust in a system that was built in a high-trust environment, a place we all thought that we would be able to be safe, because who would steal from the poor? As Colin outlined, many people, unfortunately, are doing just that, and we're coming after them. What we're exposing today is a diabolical breach of trust, a violation of the sacred bond between patient and caregiver. It is a catastrophe that can only be dealt with in the way we'll be outlining for the rest of this presentation. Today's defendants included an aide who billed Medicaid for care claimed to be delivered while they were in jail, or while they were being arrested, or while they weren't in the country. The list goes on and on, one more disbelievable than the next. And it's not just individuals. There's a home care agency, 2 owners who are charged with billing Medicaid hundreds of fabricated clock-ins. Again, care that was never delivered at all. And we have evidence of that. CMS's job is to make sure this money reaches the people who actually need it. That's the grandmother who desperately needs this money to stay out of a long-term care facility. It could be a vet who relies on this to get help because he's stuck in bed. All these individuals deserve our love and support, not the criminals who have hurt them. We've reviewed Pennsylvania's personal care billing trends. I'm going to give these numbers to you slowly because they're really important. This is the federal government's data on Pennsylvania. Pennsylvania ranks 5th nationally in average monthly payments, both per beneficiary and per provider. That is way out there. Be number 5 in both those categories. More expensive, that is, in 45 states. Over 96% of personal care claims here are illness unspecified. That's how they're titled. So we can't track them. It doesn't help if the U.S. Attorney or the Attorney General can't possibly find the fraud because people aren't actually telling us what they're really doing. We have to change that history that's evolved here into the norm. And finally, average payments per beneficiary, more than $50,000. Think about that, $50,000 per person getting home care in this state on average, far above what you'd ever expect. All this points to fraud. The cases like these are exactly why a whole government approach is so critical and why we have to develop best practices of how to evolve this system. You're going to be hearing from Dan Brillman in a second. He runs Medicaid. He's going to touch on another problem that's a big one in Pennsylvania, which is autism care services, and why they're, again, not only are they off the chart in Pennsylvania, but the rest of the country, but we are actually here to help. We're giving you a toolkit that will allow the state to be able to tell what's good, what's not, what's foul, what's fair, so we can identify the best use of our funds. Yesterday, I was in Maine. We're investigating home support services, just like you're seeing here, for adults in that case who have autism. Medicaid spending of the top 10 providers there has dramatically increased over the last 6 years. In fact, across the board, if you look at fraud in healthcare, all gone up in the last six years. What happened in 2020 that has catalyzed this? What has allowed this corruption to be weaponized? It's COVID. COVID appears to have unleashed massive fraud through grifters because criminals knew the federal government would not follow up on the money that was spending out. We told the world we were open for fraud and they could start harpooning us with their spears. No mas, no more. We are now making it very clear this administration will not tolerate this fraud, the massive increases that have grown to the kinds of numbers you could not imagine being able to show on a clipboard, with 90% of services billed and paid for, in Maine in particular, where there is no justifiable backup for it. 9 out of 10 services, you can't justify they should have happened. It's the opposite of what you'd normally expect. We have no tolerance for anyone who invents hours, invents a disability, invents a workforce at the expense of people who depend on these programs. And if you love these most vulnerable Americans, you should care as well. With this all-of-government approach, no scheme is too sophisticated, no fraudster is too elusive. This all-of-government approach includes the states, which is why you have state representation here. And these kits that were crafted are going to help these states, all of them, cope with this problem. We have at CMS an additional bit of information about these problems that Killer Kim, as she's gotten to be known, is going to describe next. And this is going to, I think, help dictate how we will intervene if these numbers are not addressed. Kim.
Great, thank you, Dr. Oz. What you just heard on the personal care front is only one part of this fight. CMS is going after all of it. I want to build on that with an update on one of the areas where we've made the most progress, hospice. Since President Trump took office, 1,076 hospices have been removed from the Medicare program in California alone. This represents a 47% reduction in the number of California hospices compared to the peak during the Biden administration. To put that in context, Los Angeles County alone had more than 1,850 hospices. So these are hospices that are no longer under review, they're not on a watch list, they are gone, thrown out of the program entirely, unable to bill Medicare, unable to touch another taxpayer dollar, unable to take advantage of another vulnerable beneficiary. And we're not stopping at California. In May, CMS put in place a nationwide moratorium on new hospice and home health enrollments, the broadest action CMS has ever taken in this space. It's in effect through mid-November, and we're using that time to investigate all existing facilities, dig into the data, and remove bad actors, not just process the next claim. That matters here in Pennsylvania, too. In its written response to Dr. Oz's revalidation request letter in late April, Pennsylvania stated that it is using the federal moratoriums as a reason to review its program integrity efforts. The state also indicated that it would implement a moratorium on newly enrolling hospice providers and evaluate whether a statewide or geographically targeted moratorium is necessary for home health providers. But CMS has not yet received a moratorium request from Pennsylvania, so we are challenging the state today to follow through on that commitment and take the action needed to protect beneficiaries and taxpayer dollars. Whether it's hospice in California or home health here in Pennsylvania, the model is the same. Stop the bad actor before the money goes out, not chase after it years after. And that same model is exactly why we're releasing something new. Today, CMS is publishing our Medicaid service area heat map per Applied Behavioral Analysis, ABA, a first-of-its-kind national look at where ABA spending is concentrated and where it's raising red flags. Pennsylvania is one of the states where that data is most concerning. I'm now going to turn it over to our Director for Medicaid and CHIP Services, Dan Brillman, to walk you through what the heat map means and what it means for kids and families here in Pennsylvania. Over to you, Dan.
Good morning. As the leader for Medicaid and Children's Health Insurance Program, when we see problems, we come with solutions. You know, Medicaid is a safety net program, and we want it to be there to catch you now and for years to come. Stomping out fraud and corporate corruption is how we ensure it is there for you. And fraud in applied behavioral analysis, or ABA, is no exception, which is why today we're announcing an ABA toolkit to help states drive best practices and policies across the country. Now, ABA therapy is meant to give kids with autism one-on-one support. They need to build useful skills, communication, social interaction, independence, delivered through direct hands-on support intended to improve quality of life and autonomy. But here's the problem. Between 21 and 2025, Medicaid spending on ABA grew 6 times faster than the number of children actually receiving the service. Nationally, went from $2 billion to $10 billion a year, a 420% increase. Some states saw 2,000% increases. One state has over now 45,000 ABA providers alone, about 9 times the number of pediatricians in the state. This should raise serious concerns for everyone. We know issues that we've seen on the news like Minnesota, where their billing for services exploded from $3 million in 2018 to $400 million in 2023, a surge driven by organized fraud rings providing kickbacks for parents to sign their children up. But here in Pennsylvania, the data tells a similar story. ABA services now, as Kim just talked about, carries a high risk score, growing from $144 million to $587 million between 2021 and last year, and the second highest in the nation for average monthly payments per provider. Here, we have had one provider who claimed to have delivered 500 hours of one-on-one ABA therapy to 2 children, 2 different locations, all at the same time. Behind every one of these families is an issue, and maybe families even like yours. There's a human cost to fraud, and incentives that reward volume instead of individualized care result in children who don't get the care that they need and families who pay the price. So today, this is the action. Every state has been asking us for help at CMS, so we're providing it. So we're launching this ABA toolkit, a set of proactive practices for Medicaid and CHIP programs to drive accountability in the program, to do the right thing to serve our children, and also to protect good providers providing good care. This toolkit's going to do 3 things. We're going to work with the states to address them. 1, individualized treatment plans that reflect children's severity and clinical justification, not maximizing hours regardless of the child's need. Now 2, integrated therapy. We should be treating the whole child, focused on integrated speech, occupational, outcome-focused therapy, not simply maximizing ABA therapy in isolation. 3rd, guardrails, things that will stop crowding out those who need it the most. Today, 75% of parents are reporting delays and wait lists. A good reason for that, $1.5 billion was spent last year on ABA for children who did not have an autism diagnosis for that care. We owe it to the families who depend on these services, the taxpayers who fund them, and this toolkit is going to be used in partnership with states across the nation to close these loopholes without delay. So we look forward to releasing this toolkit today to the public and hope everyone ensures resources remain available for those who need it the most. I'm going to turn it over to U.S. Attorney for the Eastern District of Pennsylvania, David Metcalf now. Thank you.
I want to thank everyone for being here. I want to thank all of our federal and state partners for shining the light on such an important issue. And that important issue is the worst theft of money that has taken place in this country has been the great fraud against the American taxpayer. Fraud against government programs that provide health care to the sick, food to the poor, benefits to those who need them, which is why we are so excited to announce our partnership with the National Fraud Enforcement Division and Colin McDonald, and also build on our alliance with Pennsylvania Attorney General Dave Sunday. Thank you for being here. As well as partnering with our law enforcement agencies, FBI, HHSIG, and others that are so important in this space. We want to attack fraud in all of its forms. As Dr. Oz, Kim, and Dan just told you, Medicaid fraud in particular has many different forms of fraud. But we want to tackle fraud from billion-dollar corporate malfeasance, from a Fortune 500 company, to the smaller dollar fraud of the cases that you're going to hear about today. And the cases that we want to highlight today exemplify a much greater problem. And it's a problem that has plagued our region and our community for many years, and that is the epidemic of home care fraud in this community. And for those who aren't aware of how these schemes work, I'll give you a brief overview. Medicaid, administered by the state, the Department of Human Services for Pennsylvania, allows a specific program whereby patients can have personal care services in the comfort of their home and get Medicaid reimbursements. But in practice, it has proven difficult to verify that those services are actually being provided, because ultimately, anyone can be a caregiver. You can be an individual with a criminal background, no medical training or background at all, and you can be a caregiver. And the beneficiary or the client can select whoever they wish to be their aide. And so therefore, two people can easily collude to scheme this system. And once in the system, and this is the important part, it's tough to verify that the services are actually being rendered, because the caregiver or the client behind closed doors simply can tap a button on their smartphone app or call in, and that record doesn't actually establish that the person was actually there or providing health care services. And the result is what you see on that chart over there, which is since the Pennsylvania Department of Human Services established this program in 2018, $120 million billed in Pennsylvania home care services in 2019. 2020, $2 billion. 2025, $8 billion. This is not the reflection of supply and demand. It is a reflection of the systematic exploitation of a vulnerable program by fraudsters and, as we allege, sometimes drug dealers. I want to tell you about these cases with two qualifications. First, all the credit goes to the prosecutors and agents. It was their hard work, their brains, their sweat that built these cases. That's why we're here today. And number two, as shocking as these allegations are, at this stage they are indeed only allegations. Every defendant is presumed innocent until proven guilty in a court of law. But they are shocking allegations. Across these cases, we have home care services billed that were not rendered by aides that were dead, that were in prison, that were selling drugs, aides who billed over 24 hours a day repeatedly for a year, aides who billed halfway around the world in Saudi Arabia, aides who were billing while jet-setting across the Caribbean and Europe. And I want to highlight two cases our office charged today. First, two defendants, Sean Murray and Charles Bowie, in related cases. Sean Murray has already been separately indicted by our office as a federal narcotics trafficker. He is in the prison behind me right now as a federal drug trafficker. And we allege that in addition to selling cocaine, he was ripping off Medicaid by fraudulent home care services that were not actually rendered. Instead, he was at the gym, he was at the massage parlor, he was on a cruise, and at worst, he was packaging narcotics to run his drug trafficking operation. In a jail call that was recorded in August 2024, Sean Murray boasted about how easy of a racket it was. He said, "This home health care is the best kept secret." This scheme also illustrates, unfortunately, that too often the clients and the beneficiaries are in on this scheme. In this case, we allege that Murray paid kickback to his clients to go along with the scheme. We allege $400,000 in total billings. The last case I want to tell you about involves a company called Benevolent Home Health. and its two founders, Khalil Williams and Selima Davis, both from Philadelphia. And we allege that this case actually originated from a DEA investigation in the drug trafficking activities of Miss Williams' husband. When DEA agents raided his house, while he was being arrested, he said, "Hold on, I need to clock out of my shift." And when the agents asked what he meant by that, he said, "Everybody is doing this. If that's a problem, you'd have to arrest the whole city." That is shocking, and it illustrates the extent of the problem that we're dealing with here. Everybody is doing this. It gets worse. After Miss Williams' husband was sent to prison, the billing for his home care services continued. While this man was in the prison behind me, the company and Miss Williams billed him for home care services. A federally charged narcotics trafficker, literally sitting behind bars in the federal detention center, was still being billed for home care services. This was after, mind you, that Miss Williams and Miss Davis were billing services while he was actually conducting his narcotics trafficking operation, packaging, selling, distributing drugs. And it gets worse. Miss Williams and Miss Davis also billed for an aide that was dead, 600 clock-ins in a year, to the tune of a total of $225,000 in Medicaid billings. In short, we are being ripped off. These cases and these defendants make a mockery of your tax dollars, but it ends today. If everybody is doing it, it takes everyone to stop it, which is why I'm so pleased to see everybody here today from our federal and state partners, because this is going to take the total force of the United States government and our state partners to combat this problem, and we look forward to doing so. Thank you.
Good morning, and thank you, Attorney Metcalf. It's been an absolute pleasure getting to know you and an honor to partner with you and your office. We've seen great progress here in Pennsylvania in building Medicaid-related criminal cases and resulting prosecutions of those who have defrauded and steal from the system, and those who neglect and abuse patients that are dependent on that care. And before I go into the details about some of these cases, I want to remind people of two things. Number one, these cases aren't just financial crimes. These are cases that directly impact the health and safety of people in our community, especially through the neglect cases where care should be given and people are being paid to provide care, and then the care is not given. And we actually have had cases in the not too distant past where people have died as a result of not receiving those medications. I'd also like to say that, you know, oftentimes as the Attorney General and as leaders, we get to stand here and have this conversation with you, but I want to make sure that we identify and thank and acknowledge all of the hardworking agents and all the hardworking prosecutors that work relentlessly on these unbelievably challenging and complex cases. And so for all of them that can't stand up here today, I want them to know that they are appreciated and they're respected, and we're grateful for your hard work. So last year, Pennsylvania led the nation in Medicaid fraud convictions. And the year prior to that, we led the nation in the number of defendants charged with Medicaid fraud. A lot of that work happens right here in Philadelphia, the Commonwealth's largest metropolitan area. But no great progress ever happens in a silo. The Pennsylvania Medicaid Fraud Control Unit, housed in my office, receives 75% of its funding from the United States Department of Health and Human Services, about $13.5 million for this current federal fiscal year. And for that, we are absolutely beyond grateful, because if it was not for that assistance, the Medicaid Fraud Control Section here in Pennsylvania would not be doing the amazing things that it is doing. And again, we are beyond grateful for that support. These cases involve meticulous investigation, requiring a lot of resources, personnel, and a tremendous amount of work hours, and collaboration with our federal, state, and local partners. Literally, none of this could get done without teamwork, without working together and collaborating, and that is exactly what you are seeing here today. The array of conduct and bad actors is wide-ranging. Some of this conduct involves very sophisticated schemes and planning, and there are other cases where we have the same clear patterns of theft and fraud, but those schemes are not anywhere near as expertly disguised. All the cases involve intensive investigations and investigative work to build criminal cases strong enough to reach convictions. It is, I want to say that again, to reach convictions, because it is absolutely crucial that we reach convictions in these cases, because the only way that we can hold people accountable is through convicting them of these charges that have been filed against them, sending a message to the world, letting them know that they will make far less money going into this than they think, and that they will definitely be convicted and go to jail. So there is a great commitment and passion required from the agents, the attorneys, and the support staff working on these cases. Last year in Pennsylvania, we had convictions against 115 defendants. Those convictions involved the recovery of about $41 million that was stolen from the state Medicaid program. That is $41 million that should have gone to the underserved individuals and families that rely on that help. Last year, it just so happens that we filed charges against 115 defendants. The partners before me have articulated this very, very well, but let me reinforce the message. Medicaid fraud is deeply impactful conduct. This is not about someone merely working the system. Every dollar stolen from these programs causes direct harm to someone who needs care and cannot afford it. And we have seen many dollars stolen through this pipeline. Again, in the Pennsylvania Attorney General's office, we don't look at these cases as just being financial crimes. We view these cases and investigations as a public safety issue, and that is very, very important. When you have millions of dollars stolen from the pipeline, the impact is massive. Take the Ashley Griffin case as a prime example. Our office just charged Ashley Griffin, a personal care attendant for 13 different agencies in Philadelphia and the Collier counties. I have to tell you, Ashley is quite the magician. Our investigation discovered an alleged 3.5-year scope of criminal conduct. In those 3.5 years, let me tell you, Ashley Griffin had some extremely productive days. According to her reimbursement submissions, Ashley worked more than 24 hours in a single day, more than 1,000 times. I say that again, she worked more than 24 hours in a single day, more than 1,000 times. And for one day, she submitted 126 hours of work. In all, we counted, compiled, and compared, and found that Ashley submitted more than 64,000 hours of work for services that she absolutely could not have possibly done. Those fraudulent entries led to Medicaid payments of more than $1.2 million. We allege that Sherelle Johnson engaged in a similarly blatant defrauding of the system. She submitted more than 24 single-day hours of reimbursements on nearly 400 separate days. Again, these might be half comical if they weren't unbelievably serious criminal acts causing a tremendous amount of harm. I emphasize, as always, that these are alleged acts, and the charged defendants will have their day in court. Pamela Greer, over a 6-month period, she allegedly submitted more than 1,300 work hours regarding home care for a recipient that we determined was incarcerated on drug charges at the time. So this individual that she said she was doing care for was incarcerated in prison on drug charges during the entirety of that situation. And then there was the Comfort Zone home health care case. We're in the final stages of prosecuting nearly 24 defendants from that Montgomery County-based case. From the owner of Comfort Zone all the way down the chain, more than $1.76 million in Medicaid fraud was uncovered. Leon Montgomery, the owner's son, recently pleaded guilty. We looked at $270,000 in Medicaid submissions from Montgomery, and we determined that he was actually in Saudi Arabia when much of that work allegedly took place. Again, these cases are not easy to assemble, charge, and prosecute. They take time and commitment. We in Pennsylvania have that commitment. We have the team who wants to do the work, and we are blessed to have the support at the federal level, which is the fuel that keeps this machine running. To my federal partners, I say thank you for all of your support. I know that we are all just getting started, and I would lastly like to remind everyone again that may be watching this that this is more than a financial crime. This is a very dangerous public safety issue, and a lot of people who should be receiving help are not receiving it because of this. Thank you.
Thank you, Attorney General, for those thoughtful words. I want to do two things. I want to introduce you to where the Inspector General's office fits into this very important team effort, and then step back a little bit. You've heard a lot of very granular, highly accurate details about how this work is done. But before I do that, I want to talk about Secretary Kennedy and Dr. Oz for a couple of sentences. These are two gentlemen who have decided to spend their lives improving American health care. That's what they care about. That's their heart. I think Dr. Oz probably spent 10 years learning to transplant hearts. And they're still doing that work. That work continues to go on. We're continuing to improve health care, access to health care, new technologies, new inventions. But this fraud has been an interruption to that effort. So Dr. Oz and the Secretary now have two jobs: improve American health care for everyone and fight fraud. So we want to emphasize that work is close to our hearts and very important. Now, the Inspector General's office is little known to most people, and I'll just give you a few fun facts if I could. We have about 1,450 employees. 100 of those employees do data analytics. 6 million transactions a day go through Health and Human Services. Somebody has to look at those and write programs using types of AI that I don't know anything about and find out where the anomalies are. So when somebody's billing for more hours than are possible, that might first appear in a database at the state level or at the federal level. They catch that, they move it over to the investigators, of which we have over 400. They start a case. They include the FBI, IRS, Homeland Security, and our other partners, and investigate the case. We also have people that do audits of these programs. We figured out in advance that something was amiss in a lot of the autism programs in many states. That comes back, and again, it goes to the investigators. Data analytics goes to work, and you find out that there couldn't possibly be that many children in these autism programs. As you may remember, in one state, Minnesota, they had $1 million spent on autism services for children, and 5 years later, they were spending $343 million, a statistic that we don't get tired of repeating. So the Inspector General has the ability to send out subpoenas, do data analytics, do old-fashioned shoe leather work, undercover work, anything that other law enforcement agents do. So I too want to thank the law enforcement people who are here. The long nights or days alone with a computer screen, looking at a spreadsheet, looking at timesheets, looking at records, writing subpoenas, doing search warrants, doing shoe leather work. They are one of the real heroes of today. Now, on the atmospheric side, you've heard a lot of details, but let's step back for just a minute and think for a minute about where we are. This is, after all, Philadelphia. A few blocks from here, one of the great documents of Western civilization was written 250 years ago. It is the theme that we all remember when we care about what's going on in our communities and our government: life, liberty, and pursuit of happiness. But there's another important value that came from another organization 170 years ago, the CHOP, founded by a doctor, Anglican parishioner, who said, I don't like what's going on with my neighbors. The mortality rate is too high. So he starts a hospital. Now think about some of the hospitals in our region. Mercy Medical, the name of that hospital. Cedars-Sinai. And don't ever forget that a group of nuns sitting over a wooden table and a bowl of soup came up with the idea for the Mayo Clinic. So these are core values that come from the idea of treating your neighbor the way you would like to be treated. So these two values, Declaration of Independence and treating neighbors with love, means that the infirm, the elderly, the disabled, widows and orphans are cared for. The least of these are not left out. Consider with me just for a second what it means that that's under attack. Who steals from these people? What kind of person steals from these people? Not the people who care about the values of the Declaration or about caring for their neighbors. They care only about themselves. And they don't care, as the Attorney General very articulately said, they don't care about what's going on with the poor or the infirm or the disabled or the children or the widows or the orphans. But I know the people in this room do, and I know that's their values. I just want to thank the rest of the partners here. It's always difficult to speak nearly last when you have all the details, but this is a civilizational challenge. People are demoralized in our country about health care. People are working to improve it. But until we get control of this fraud, if you think back 2 or 3 years what the Government Accounting Office said, take a look around the room. 1 in 5 of us was working all year to pay our taxes, and they were being stolen. 1 in 5. That's how much the GAO estimates we're losing in these programs to fraud. And this is a group that says not on their watch. I like no moss. And I also like Dr. Oz's quote, he didn't use it today, but he often uses it, that if we took the fraud out of Medicare and Medicaid alone, we'd extend those trust funds 5 years. That's caring for your neighbors. That's making sure life, liberty, and the pursuit of happiness applies to everyone. So thanks again to the shoe leather, the late nights with the screen, the spreadsheets of the agents, and also the kind comments of the Attorney General. My office funds and certifies 50 Medicaid fraud control units around the nation. Pennsylvania's in the very upper echelon, and one of the ones we ask others to look at. We've got a handful of very non-productive ones we're working with very closely to get them up to speed. But I want to thank the Medicaid Fraud Control Unit, which has some very hardworking people, but leadership matters. I thank the Attorney General for his leadership in that area. I also want to introduce you to Brad, my good friend, Scott Brady. His name is not Brad, Scott Brady, who we had at HHS and was stolen away from us by the President's Fraud Task Force.
Thank you, March. Good morning, everyone. Thank you so much for being here today. I'll keep my remarks brief. I want to really everyone to focus on the great work of the Department of Justice and the State Attorney General. As March said, my name's Scott Brady. I'm the Executive Director of the White House Anti-Fraud Task Force. In President Trump's first administration, I was the U.S. Attorney for Western Pennsylvania, so it is good to be home, as Dr. Oz said. Today is about accountability. Today is about bringing fraudsters to justice. And today is about making Pennsylvania safer than it was yesterday. As you've heard, during the previous administration, we witnessed an explosion of fraud across the United States. And this fraud crisis impacted virtually every federal government service in every state in the union. And what we have witnessed truly shocks the conscience. From the Leering Center in Minnesota, to fake hospices in Los Angeles, to here in Philadelphia, a fraudster running a home health care business from that prison, billing for services never provided, stealing your tax dollars, stealing from the poorest and most vulnerable of our citizens. In response to this crisis of fraud, President Trump and Vice President Vance have launched the most comprehensive, most aggressive war on fraud in American history. Under Vice President Vance's leadership, the Anti-Fraud Task Force leads 15 federal agencies in an all-of-government strategy. And President President Trump's mandate to us is clear. He wants us to stop fraud by first preventing money from going out the door, and second, thanks to Colin McDonald and the Department of Justice, he wants fraudsters put in jail. Full stop. Today, two of the task force's most important partners, the Department of Justice and the Department of Health and Human Services, are delivering justice to fraudsters. I want to thank Acting Attorney General Todd Blanche, AAG Colin McDonald, HHS Secretary Robert Kennedy, and CMS Administrator Oz for their tireless leadership. I also want to recognize U.S. Attorney David Metcalf and Pennsylvania Attorney General Dave Sunday for their leadership in fighting fraud and keeping Pennsylvania safe, even while other Pennsylvania leaders look the other way and do nothing. Fraud is not a victimless crime. Fraudsters steal from all of us, and real people get hurt, as you've heard. Our families, our friends, our neighbors, these are the people we are fighting to protect. For me as a Pennsylvanian, as a Pittsburgher, this fight's personal. I was raised by a single mother in a small apartment in inner city Pittsburgh. As a young boy, Mom and I moved to a small steel town outside of Pittsburgh, where during the 80s, we had the highest unemployment rate in the entire United States. As the mills shut down, 40% of our town was unemployed. My family, every one of my friends' families, received unemployment benefits and government cheese and butter until we got back on our feet. America is the most generous nation in the world. Hardworking Americans turn over trillions of their hard-earned dollars to fund our benefits programs, and they do it to help their friends and family and neighbors through hard times. And they do it because they rightly expect that if they fall on hard times, those programs will be there for them as well. If we don't stop this fraud, these programs won't survive. American citizens will suffer, and this is not a partisan issue. No matter what your politics are, if you care about Medicaid, if you care about Medicare and other benefit programs, you should support fighting fraud with everything you have, as we do with everything that we have. Under the Vice President's leadership, the task force is working incredibly hard every single day to fight fraud in every agency, to stop fraud before it happens, and to find, arrest, and prosecute fraudsters. We've already stopped tens of billions of dollars in fraud, and we've already indicted and convicted hundreds of fraudsters. And as you've heard, we are just getting started. Let me be clear. If you steal from hardworking Americans, if you steal from our fellow Pennsylvanians, your days are numbered. We are coming for you. This fight is personal, and we will never stop. Thank you.
Thank you, Scott. We'll take a couple questions now. Yes, sir.
They're dealing drugs out of the prison. How are they getting a cell phone or something to clock in and out of in the prison?
So I think you're referring to one of the charged cases, and I won't get specifically into the allegations of that case, given the open nature of that current prosecution. But speaking generally, what these schemes involve are individuals who are not where they say that they are, and who are in a conspiracy with someone else away from their location, where they can work together to then exploit this program. As U.S. Attorney Metcalf said, once these individuals are inside these programs, it's very hard to be able to determine whether or not the home care services are in fact provided. And so that's why someone from even prison would be able to be in a conspiracy with someone outside of prison to keep billing, to pretend as though they're in a different place at home providing care to an adult relative.
Can I add something? So
Yeah.
in that case, the person in prison was being billed by a co-conspirator. The person themselves was not billing it. So take Ms. Williams' husband, in that prison behind me, was being billed by Ms. Williams while he was in prison. The allegation in that case is not that he had a cell phone billing in prison, just to clarify.
And what are we looking at with those pictures there?
So I'll start from there. That's the chart I described in terms of Pennsylvania Medicaid spending. The first quote is from Sean Murray in a recorded jail call in August 2024, bragging about how much of a racket home health care aid is. The second quote is from Miss Williams' husband when he was arrested for drug trafficking, explaining the prevalence of home care fraud, that everybody is doing it. The pictures themselves, I'm going to go from the top to the bottom. The top are from the social media accounts from Sean Murray that show him posting in various locations around the globe while billing home care services. From the bottom, these are surveillance photos taken by federal agents while Mr. Murray was billing home care services, but we allege was in reality trafficking drugs.
Are all of these cases connected to that same agency, the Comfort Zone Home Health Care LLC, or are they a variety of agencies?
These cases kind of span the spectrum of different actors and different entities that are involved, but all of them are connected by that common theme of exploiting this home health care program. Yes, sir.
Just a question perhaps for you or for Dr. Oz. What efforts are being made to make sure that legitimate home health care providers and their patients aren't getting perhaps caught up in this intense dragnet scrutiny?
Our biggest allies in cleaning up fraud are the legitimate providers. Kim Brandt mentioned hospice care. We've taken out almost half of the hospice centers in the entire state of California. Almost nobody has complained. We've gotten a couple AI-generated notes. The people who told on them were the other half of providers that actually are legitimate. We've asked the state of Pennsylvania, we've asked all 50 states, and this was with the support of the White House, to revalidate their home care providers. Remember, we're talking about unlicensed individuals in an unmonitored setting. How do these guys enforce those rules? So we've asked the states to go back and tell us, what does it mean to be a home care provider? And then tell us, because of your own rules, whether your providers have done that or not. The state of Minnesota, when they did this, less than half of the providers in these areas were legitimately, by their own rules, eligible to provide these services. When they say everyone does it, that's the pathology. Like, what is going on in Pennsylvania? The reason we have federal law enforcement here, and representatives from the federal government, is because we are concerned. We're concerned about a lot of states. But this is personal, obviously, for me, because I'm from the States. Dan Brillman is, Scott, a bunch of us are. Obviously, people who work here are. So what is going on in our state? How can we be top 5 spenders in the amount of money in home care for individuals and providers? Like, we're overpaying people doing the work, and more of them than really legitimately could be doing the work. And then we're also paying too much per person. So we think there's a easy way of threading this massive hole in the needle, which is cut out the fraudsters, which again, mathematically could be a lot of them because everyone's doing it, and other states have given us a clue that it's a problem. You know who we help? We help the American people. We help the folks getting these benefits, but we also help the legitimate, appropriate providers, because they're not just stealing money. These fraudsters are stealing our trust, and that's a much more difficult thing to replace.
Yes, sir.
Question about electronic visit verification. That is supposed to make sure people are getting paid for being at work. So is the idea that you have the person who's the recipient, the beneficiary, is the one who's doing the verification, even if the person is in Saudi Arabia? And how does someone who's billing 13 different agencies, they have to do the EVV, right, for all those visits? How does
From the heart of Philly, this is CBS News Philadelphia.